Welcome, everybody. Thank you so much for joining us. It's Thursday afternoon. It's been a long week, but I hope you are ready for an exciting session to talk about innovation, solutions to get us energized. For tonight's Rock the Hague, we are here with an excellent panel. The objectives of this session really are to understand what innovations are out there, how do we take them to scale, how do we reach the communities most at need, and what are some of the barriers and challenges that we need to work together on to overcome. So we've got a quick video from Rodger Voorhries of the Bill and Melinda Gates Foundation to kick us off and do some framing remarks, and then we'll get on with this really amazing panel.
Good afternoon, and thank you for inviting me to speak to this group of nutrition leaders, experts, and advocates. My name is Rodger Voorhries, and I'm the president of the Global Growth and Opportunity Division at the Bill and Melinda Gates Foundation. Special thanks to dsm-firmenich for organizing a session on the role of innovation. This conversation is especially timely as we face another difficult year for food and nutrition security. According to recent data, over 3 billion people suffer from at least one micronutrient deficiency. Despite these staggering numbers, we are not on track to achieve any of the SDG2 nutrition targets, and the COVID-19 pandemic, the Russian-Ukraine war, and the worsening impacts of climate change are threatening future progress. We know that addressing micronutrient deficiencies is one of the smartest investments governments and donors can make to advance health and economic prosperity. Deficiencies in folic acid, iodine, iron, vitamin A, and zinc are responsible for an estimated 2 to 5% loss in GDP. Conversely, every $1 invested in food fortification generates $27 in economic returns from disease prevention, improved earnings, and enhanced productivity. The foundation focuses on improving nutrition through a number of complementary interventions, from nutrition counseling and micronutrient supplementation to healthy diets and large-scale food fortification. Our food fortification strategy works to increase and sustain coverage of adequately fortified foods among populations at greatest risk for malnutrition. And our approach spans the entire value chain from innovation to impact. In order to fast-track progress, we will need multiple types of innovation working across the entire value chain to realize the full potential of large-scale food fortification. First, we need to innovate approaches to collecting and using data to help countries ensure they are fortifying the right vehicles with the right nutrients and reaching the people who can benefit most. Next, we need investment in R&D to expand the range and levels of micronutrients that can be included in different types of staples. This includes exploring the addition of more nutrients in iodized salt, the viability of fortifying widely consumed products like bouillon cubes, and new approaches to improving the bioavailability and absorption of iron. We also need innovations that empower and motivate champion millers. We are excited to support the Millers for Nutrition Coalition, a critical platform to enable millers to increase the quality and availability of fortified foods. Finally, without credible enforcement mechanisms, food producers have little incentive to comply with standards. Innovations in quality testing methods can bring systematic, low-cost digital solutions within reach. Together, we can realize improvements across the LSFF system. With the right innovations, we can reduce the inhibitory effects of phytic acid to improve absorption of iron from cereals. We can enable access to new sources of finance for small mills, and we can deliver advancements in mobile technology to allow for better progress tracking. The possibilities are endless, and the cumulative impact of these innovations could be transformative for the populations most impacted by malnutrition. Food fortification has been around for more than 100 years, and now we are facing a critical inflection point. Never before has there been this level of research and effort directed at co-creating new solutions to address this intractable problem. At the Foundation, We remain committed to supporting advancements in fortification to address micronutrient deficiencies, and we look forward to continuing to work with all of you to make healthy, safe, locally produced diets accessible for everyone.
That was a breadth of experience and innovation that the foundation itself has supported. We had a really amazing victory this year on the area of large-scale food fortification with the World Health Assembly passing a resolution on it. So we can dig into that a little bit more. So with that, those opening remarks, I'd love to turn to the panel, but I realized I didn't introduce myself, so I will do that. My name is Asma Lateef. I'm the Policy and Advocacy Lead at the SDG2 Advocacy Hub, and it's my pleasure now to turn to Dr. Mandana Arabi, who will talk to us a little bit about bringing innovations to scale and the role of public and nonprofit sectors, the role that they play. So Mandana, over to you.
Thank you very much, and thanks to the organizers for putting this amazing panel together today and to talk about the topic of innovation. I wanted to approach this, and I do have a few slides. I don't know if they're going to come up or not. Okay, perfect. Yes. As Asma noted, I wanted to talk about innovation from a public sector perspective. I work for Nutrition International, and we are an international nonprofit organization based in Canada. We have 10 country offices, and we mostly focus on nutrition interventions that are proven, especially in the micronutrient space, such as vitamin A supplementation, fortification, maternal supplementation with iron, folate, and now multiple micronutrient supplements. So a lot of experience in really working in the public sector and with the public sector, and of course, identifying areas where innovation is needed. So, I wanted to first also show you how the program cycle looks like for an organization like Nutrition International. It was really interesting for me to hear, for example, Rodger, the previous speaker, talk about innovation across the value chain. In that sense, we could also look at the innovation across what we call the evidence-to-action programming chain. So we start from identifying what works, interventions that work. We know, for example, fortification, let's say with iron, is a proven intervention. It can improve iron status. It can really improve in the long run at the population level, the nutrient status of the population. So we know it works. And then from identifying interventions, which is this starting point of the evidence, there is still a pathway towards action and a scale. So we have to first design robust interventions. In order to do that, you have to invest in things like formative research, in mapping of partners, delivery channels, in looking at how you develop your program pathways, before you can even start kind of advising countries and advising, especially that's the mechanism we use for working at the country level, advising usually the ministries of health and the program managers at the country level about, okay, how do you even take this intervention to the populations? Then we actually have to also prove implementation success. So as these programs are being set up, you can't assume that they would work in real-world conditions. There's always a pathway from proven interventions, from efficacy trials to effectiveness in the real world. And that's where we need to do process evaluations, we need to do output-to-purpose reviews, and really do this quality assurance cycle throughout. You could do quarterly analytics, you can look at just kind of providing knowledge and technical assistance throughout programming, and throughout implementation, we provide ongoing technical assistance to the governments, supervision, at the same time constantly translating global evidence, as recommendations are updated, as nutrient recommendations are updated. All of that needs to be embedded in an ongoing basis in the program cycles. And then over time, for an organization like NI, because we implement multiple interventions, these turn into portfolios of programs. For example, we have a portfolio on child survival. Everything you can do to maximize child survival, and that includes many, many different interventions, infant and young child nutrition, vitamin A supplementation. So you need to also look at how the mix of these interventions works together and how they interact with each other. And in order to understand that, we look at the general general evidence on impact, general evidence on what is the optimal mix of interventions, and we then also need to bring those findings for a scale up at the national level and also regional and global level even. So I think for me, I felt like I should start from this programming cycle because we really need to actually have innovation across the board, across all the levels of this cycle. So while a lot of us get excited about a new product or a new, micronutrient supplements, that's definitely important. That's an important innovation. But an innovation in how you deliver that supplement to the population is also innovation and is also needed and is also important. And innovation in measurement and innovation in behavior change. So we really are actually in need of innovation throughout the program cycle. And I think maybe we have also invested differently. There has not necessarily been investments in innovation across the board. We sometimes know a lot less about how to deliver in comparison to what to deliver, again, because we get excited about new and improved products or supplements, but not necessarily excited about, okay, now we have to figure out a completely new way to deliver this more effectively. And we may need to do behavior change and training differently. So these are the kinds of things that I think in the public sector, we definitely are cognizant of their importance. And I think sometimes also maybe the innovation investments in some of the areas should come from the public sector. So that's how I felt the framing should come from, again, coming from the public sector. I think the role of public sector innovation first would be in actually identifying and solving public problems. So there are certain kinds of problems that are of public nature. They may not even be on the agenda of other sectors. They may not be things that, are affecting a large section of the population, a large market. They may have implicit economic benefits, so it may not be obvious that there would be a business case for addressing them. And these might be also problems that are embedded in the public health system. So, I'm a trained physician. As a doctor, you think if you prescribe a medicine that's the novel, the most, the advanced treatment, that's the solution, and that will take care of your patient. But then I learned as a young practitioner that that's just the beginning, actually getting that patient to comply and, to really make sure also that they have an approach towards their health in a holistic way and think about other things that might affect that proven intervention is also important. But I think these are the certain problems that are embedded in the health system. The experience of a patient in the health system is very important, but probably innovation in, improving the experiences, improving the behaviors could not be something that is top of the agenda for innovators in other sectors. But I think for the public sector, this would be a problem that needs to come from the public sector, identified as a research agenda in order to be solved. So the first role would be for the public sector to identify problems, and that's an important role to play. An example I wanted to bring up is how we have used, in a digital-based advanced system to deploy a fortification information system. And this is a problem that was identified as a public problem, the country level, this not having the ability to actually collect data, analyze data, especially on beet flour and edible oil information. So this is the Fortis, which is an innovative system for doing exactly that, and really in the same way that you have a health management information system, having this related to fortification. And NI has been advocating with the government to integrate this into their monitoring systems over time for sustainability. And this is using a digital tool to improve the efficiency of data collection, reporting across the board. We are using a field-based actually checking mechanism to look at the quality of fortification and also then have that input into a software that can allow us to follow the basically quality of fortification over time. And the scale up of this digitalization can help us improve accountability in implementation, in enforcement, which was also mentioned by a previous speaker, but for industry and government and all the other sectors. But I think this was a good example of a problem that is actually identified by the public sector and to a great extent needs to be implemented through the public sector, but would be a benefit across the sectors. The second category that I wanted to mention is also about public sector can actually orchestrate public actors to develop solutions, right? So, of course, you identify problems and that need solutions, but you can also, public sector has some unique capabilities for leading to solutions. For example, this could be about access to data, better understanding of beneficiaries, ability to influence actors, and legislative and regulatory influence. And this is just an example of something that we are looking at, looking at health management information system data, which is in ownership of governments, to see whether we can use that information to predict program vulnerabilities to future shocks. Especially in the context of COVID-19, we came across this being a really large issue, as you can imagine, and the stock outs of supplies and disruptions in supplies being a major issue. So we are trying to use the government information systems built for other purposes to actually solve a problem that could allow us to predict vulnerabilities and potentials for breakage in future. So this could be an example of how the public sector can lead to a solution as well. And then the third thing I wanted to end with, and this is the topic that's close to my heart, and I really am hoping to highlight it, is it's also about channeling innovation towards the most in need. And I think this is an important role of the public sector. It is the equity focus. And I will end actually by a quote that's from a blog by Bill Gates over the summer. It was after the ChatGPT had been introduced, and of course with all the excitement about this. And for me, it was amazing that he is actually saying that market forces won't naturally produce AI products and services that help the poorest. And I think even acknowledging that is an important fact. We should not assume that even something publicly available and a tool that's out there with a lot of benefits would actually be channeled towards the poor. And that's where I think investments also need to come from the public sector to make sure that we channel these innovations towards the problems that need to be solved in our views. As he says, reliable funding and policies, government and philanthropy can come together to make sure that these innovations are translated for benefiting the poor. So I would end on that, and thanks so much for bringing me here.
Thank you, Mandana. So two key takeaways. Yeah. That innovation doesn't stop at the product, it's at every step of the way, and let's leverage the unique role that the public sector plays in this space. Anneleen, Dr. Anneleen Spooren is the head of innovation for R&D and regulatory at dsm-firmenich. You're going to speak about how cost-effective innovations help improve existing nutrition interventions. Feel free to use the podium. I'm told that the visibility is much better at the podium, so if you'd like to do that. I will comply. Yes.
I want to share 3 insights from more than a decade of dsm-firmenich being active in nutritional improvement, and illustrate each with a small examples. And let's bring up the visuals. While that is being brought up, the first one is that a very smart man said everything needs to be as simple as possible, but not simpler. And that is a really important insight when it comes to innovation. It was already highlighted by the previous speaker that in the end, innovation is about compliance. We need these technologies to be adopted by people, and people will adopt them if they are intuitive, easily embedded in the daily routine, and it doesn't present a hurdle to them. And especially when it comes to nutrition, that is super important. One of the innovations that many people have been working on, including us, is the fortified kernels, and that is an excellent example of how you take a major staple food that is actually counterintuitively maybe very poor in nutrients, and how through a decade of innovation in technology you can create an impactful intervention. And it sounds very simple, but what goes behind it is the need to have ingredients that are stable throughout a very harsh extrusion process and that are still bioavailable when they are consumed by people. And this is actually an inherent contradiction. So working on the vitamins and the minerals in a way, protecting them, that they survive the extrusion process, but still making them available is one of the challenges we had to solve. Similarly, there's a role for digital tools here to enable a better creation of the kernels so that they cannot be distinguished from the regular kernels. And again, that has to do with compliance and adoption and simplicity, because we don't want these kernels to stand out. And there are so many different types. That's one of the things that I learned working in the field of rice, that I never realized this before. And extruding each single one of them in the right way requires a lot of technological innovation. But it's also about quality control throughout the whole production chain and throughout the complexity. Another insight is that innovation is very often about solving a problem with an inherent technical contradiction. You're always somehow hitting where you have to improve a certain parameter, but when you improve that parameter, some other parameter that you also need actually worsens. And I think one of the best examples of that in this world is still the #1 micronutrient deficiency to this day, iron. It sounds very easy to solve the problem. We just increase the amount of iron. Yet that clearly has not worked. And the reason it hasn't worked is A, because iron is so reactive, it is critical to our body, but it also makes it potentially toxic. So our body has evolved various mechanisms to protect from overexposure. So the more you give, the more you inhibit. The other effect is that by overdosing, we're also understanding better and better that there are damaging and oxidative effects on your gut microbiome. And definitely one of the new frontiers for innovation will be how do we better understand what these billions and billions of organisms in our digestive tract are actually doing to keep our health and to help feed us as they also protect themselves, and to make sure that whatever nutritional intervention we do does not negatively impact that gut microbiome. So in order to solve the problem, in order to solve this inherent contradiction, you need to look at the things in a different way, and we need to abstract the problem. Just keeping on adding iron is maybe not such a great solution, and we need novel approaches. And so phytic acid, as most of you probably know, is one of the big inhibitors that is present in plant-based foods, who are naturally relatively rich in iron, but it's inhibiting the uptake. So how can we, through enzymatic processing of foods or direct delivery, actually increase the absorption without adding extra iron? And then the last insight, I think it's very clear that in order to just survive or to be successful, it will all come down to one thing, and that is the collaboration that we can achieve. And there is not a single innovation example that I can think of that did not take multiple partners and multiple millions. And it's true in every different sector where you will look, you will find the same thing. We are very proud of the partnership that we've had with the World Food Programme, developing a range of interventions, but also with other partners in the field. And one of the most recent examples that we've been working on was to bring a more sustainable form of packaging for micronutrient powders. Now, this was, again, multiple years, multiple partners, and multiple billions. So it took one partner to make the polymer. It took another partner to make the polymer into a film. It took another partner to put the film onto the paper. It took another partner to take the film on the paper and make a sachet. And then it took another partner to basically fill the sachets with the micronutrients and to test whether they can withstand the harsh Zone 4B climate and stability conditions, which again is an inherent technical contradiction because you want to protect, but the more you protect, the less sustainable the packaging solution becomes. And it will take even more partners to scale these type of solutions, both public and private partners around the world, and to make sure that these solutions become widely available. And that's up to all of us in this room.
Thank you very much. It's very clear. People, constant innovation, and collaboration. Our next speaker is Adeline Lescanne-Gautier. She's the general manager of the Nutriset group. Adeline's going to speak to us today about leveraging emergency nutrition solutions to tackle micronutrient deficiencies in elderly European populations. So really looking forward to that.
Thank you. Hello, everyone. When you ask us to speak about innovation, usually as Nutriset, we speak about plum peanut or SQLNS, but I've tried to see, okay, what else we can do in terms of innovation, a bit different of what we are used to speak about. And so we work on children and how do we feed children. At the beginning was really the name. We were even not speaking about malnutrition or nutrition, but feeding. And the idea has always been for us to focus on the needs and to transform a needs in demand and not start from the market. And I think it's really where we've been innovative at Nutriset. We revolutionized the care by not only the nutrition content, because the nutrition content, we all knew already what we should put in the product, but really in terms of use and how we make sure that each people along the chain will be able to take the product, and at the end to have the product eaten by the good population. The needs are really depending on the population we are targeting, but also about the system that will use the product. And finally, 4 years ago, I think, or 5 years ago, we realized that even in France, there was malnutrition, and our grandparents were dying from malnutrition in France. So we tried to use exactly the same model we did to develop Plumpinut or SQLNS, and to use this methodology in France with elderly people. In fact, we took the paste, because we know very well the paste, and at the beginning, to be the real story is that my grandfather was ill, and it was difficult for him to eat, and my grandmom gave him half a sachet of Plumpinut every day during 30 years, and the doctor was very impressed that he was still alive and very well. So we give Plumpinut to a lot of elderly people in Normandy, and they were good. So we decided to find a better product, more adapted for them. But the nutrition density, in fact, it was very, very important, because we realized that elderly people, they are not able to eat a lot. We believe they are not hungry, but in fact, they've got a little stomach, and they need more than any other because they do not transform correctly. So it means that, in fact, the density that we had in our product were very good already for them. Of course, we always work on product with proven acceptability, but especially easy to use. When we look at the idea I told you was really to go all over the chain of people working in this product, on how we make sure that we will ease the life of each of them. For example, of course, we speak about the nurses, and before they had to go in each room to give one product. Now our product is used in the recipe at the kitchen level. You just add 1 spoon. In Normandy, we add fresh cream spoon in the soup. Here it is paste, but that's the same idea of protein and nutrition density. And in fact, as it is at the kitchen level, that is the idea to put the nutrition at the good moment, at the moment of the lunch or dinner, which is the best moment we have in France. And it was very important to have nutrition not given by a nurse in the room, but given by the cooker at lunch or dinner. So for all these people, we ease their life, but also we give more value to their work, because before the chef will say, okay, I give soup, but I don't have enough vegetables, they don't like my product, or it's not rich enough. And now we give them more value, because he's able to give the good nutrition, and he wants to give the good nutrition at the beginning. So in terms of a very surprising result, for example, so we did an important study and a very, very incredible result. Today, with the normal product existing in France, and I suppose in a lot of European country, if you give 1 CNO per day, 9% of the patients at hospitals, they've got the proteins they are supposed to have. With our product, just to put the same amount of protein, but in the lunch or in the dinner, we've got more than 40%. So we've got four times more people who've got the protein. We've got a lot of research, and we divide the cost of the support by 2. It's not the cost of the product. And we spend a lot of time, even in the world of humanitarian field, to speak about the cost of the product and not about the efficacy of the program. And in fact, if we've got a better product with less cost of program, I prefer to put a lot of money in the product to have a good product and less in logistic chain, for example. And with this product, we realize that what has big cost in hospital in France is to order one product. Just to do one order, it's 80 euros. And usually they were doing orders every 2 weeks. With our product, they do only twice per year. So that is the biggest improvement in terms of cost with our product, is to do less orders. So really, by going at each step of the chain, we can increase the value of the product. So the idea is really for us to always look at the vulnerable population, the needs, and after to go all over the chain and to make sure that we are pragmatic, simple, and so we will be able to be innovative just because it answers the needs there is during the chain.
Thank you very much. Thank you. So focusing on the constant, on all the aspects of the care that's delivered and focusing on the needs of all the people in that cycle, that's amazing. We have Mayank Anand, who is the Vice President of MedAccess, who's going to help us connect the dots between what we're thinking about in nutrition and what's worked in the innovative finance space in other sectors, and the health sector in particular. So over to you, Mayank.
Thank you, Asma. And I hope you can hear me. I hope I have to not bend too much, but let's try. Work with MedAccess. Not sure how many of you might be familiar with us, but today I'm going to talk less about innovative financing in nutrition from a MedAccess point of view, but how can we bring good examples of investing in innovation, innovative financing in other health sectors. Quick overview, MedAccess is a social finance company, a social enterprise established by UK's Development Financial Institution, British International Investment, with the objective of investing in innovative financing tools to help improve access to drugs and diagnostics, which otherwise may not be as easily accessible. We were established in 2017 with seed capital of $200 million, and we used that to invest alongside partners, suppliers, institutional procurers, primarily with three types of tools: volume guarantees, procurement guarantees, and market shaping loans. Before I go into describing what a volume guarantee or other innovative financing tools could look like, let's take a second to just reflect on what is a market failure or what causes a lack of access to key products in markets. If you, for a second, imagine the value chain of from the time a product is discovered all the way to the time it's actually consumed by a beneficiary, there are several steps in between. And at each step, you would actually see several reasons why either suppliers are hesitant to launch a new innovation in a market, or even if they do, there could be hesitancy in terms of the pricing and the risk pricing that's associated with it. MedAccess tools are most well placed to actually solve some of the challenges in the three intermediate steps. So from discovering, developing, and testing, to approving and registering the product in the market, to scaling up capacity and manufacturing the product, to procurement, distribution. There are so many challenges that I wouldn't necessarily go into too much detail about today. But specifically, when it comes to scaling up and manufacturing, one of the key challenges we hear a lot of suppliers speak about is the unpredictability of demand and the risk that you expect in markets as new innovations are being launched. Alongside, often, there could either be limited access to capital in terms of addressing working capital needs, or if you think about local manufacturing capability, which is a huge topic, particularly in Africa, we also hear concerns around creditworthiness of manufacturers and how they might need additional support to address that. When it comes to procurement, the challenge, of course, is familiar to all of us in the room, that procurement has struggled a lot with either low or variable funding, depending on the source of financing that you're getting it from. Is it domestically financed? Is it financed through larger development banks, development financial institutions, philanthropies, etc.? However, in general, the key challenges are procurement is often fragmented, decentralized, particularly when you think about nutrition commodities or the broader commodities in the maternal and child health space. And finally, when it comes to actually distribution, there is also challenges around access to capital. Now, so what is a volume guarantee, which is one of the three tools that we look at? A volume guarantee is a financial and a contractual commitment between MedAccess and a manufacturer or a supplier of assured sales or volumes of product over several years. In return of that, we agree and align with suppliers on ceiling prices when they're trying to launch these products, in securing production capacity commitments. And often, you would actually see certain suppliers being hesitant to register very actively in markets unless there's a clearer pathway. In those instances, again, a guarantee on volumes can actually help clear out the pathway for suppliers. As a result, we see improved access to products at more affordable pricing and more consistency in availability of these products in the markets. To walk you through one of the examples, so this case study is focused on tuberculosis, which might actually be a bit refreshing given we've been talking about nutrition for a few days. But when you think about TB and preventative therapy, people living with HIV are more susceptible to tuberculosis and often are recommended with the preventative TB therapy. Now, this preventative therapy has been around for over 60 years, but the adoption and the adherence has been pretty low, primarily due to the length of the treatment. Now, a new product and a shorter treatment regimen called 3HP was launched. However, there were a lot of challenges in access, either because of the price or because suppliers are unable to offer these in markets. MedAccess worked with one of the suppliers, Macleods, to provide them with a volume guarantee that helped them in commercializing this new product, which allowed them to dramatically scale production capacity, agree on a ceiling price, which was $14.25 per patient course in this instance. And as a result, we saw that the volume guarantee in the first year of the deal itself helped unlock access to over 500,000 TB patients, reduced the price by 32%, leading to savings in procurement by $22 million. And I think the most interesting point is it helped accelerate registration of the product in 8 new countries. We, of course, work in collaboration with several partners. Financing is a very small part of any market-shaping initiative, and therefore for this we worked alongside UnitAid, the Autumn Institute, and CHAI to deliver on this. So, nutrition and what is the role for innovative financing in nutrition? There's a great section that I would highly encourage you read in the Global Nutrition Report for 2021, written by Dr. Meera Shekhar, which projects that between now and 2030, over $10.8 billion will be required on nutrition-specific initiatives to help achieve the 4 goals of SDG focused on child and maternal undernutrition. Now, this is extremely daunting given domestic financing is still low compared to pre-COVID levels. ODA financing, you saw an increase in ODA financing over the last decade or so. However, that is plateauing. And therefore, we need more innovative types of financial instruments to help encourage innovation in the market, to launch newer products that can accelerate progress towards the SDGs of 2030, and by either launching new innovative products, scaling access to nutritional commodities, and maximizing the use of donor and public sector investments. And we believe that instruments like volume guarantees could potentially play a role in addressing this gap. And finally, I think worth noting that we are constantly innovating and working with a range of partners from non-profit organizations to suppliers to institutional procurers, again with the objective of how can we use financing in a way that can accelerate progress. Thank you.
Thank you. It's all about managing risk at the end, right? So we now have Kalpana Beesabathuni, who is the Managing Director of Sight and Life. She's going to talk a little bit about designing innovative business models to improve access to affordable nutrition in low-income countries.
Thank you, Asma. So today, I want to ask the question, why are we discussing business models for public health especially? So there are about 4 billion people that bear the poverty penalty, and this stems from market inefficiencies and institutional gaps. That's because the funds are scarce, access to public services at the base of this pyramid. But more and more, it's no longer looking like a pyramid. As economies of, as the different nations across the world have their incomes rising. You see a majority of the underserved population belong to the bulk of this pyramid, which is looking like a pear-shaped, and they are more keen to pay for a public health good or a public health service with better quality, and they access it from the markets. However, currently, all of these products and services, they face exorbitant prices, but also the market is flooded with counterfeits and insufficient availability, especially with nutrition products and services. So today, I would like to spotlight 5 business models that tackle some of these market inefficiencies and uplift the underserved population, predominantly the underserved group that is that cannot avail the humanitarian aid. So the first type is called a social franchising. And here, the health clinics or pharmacies, which are run by franchisees, are central to this model. The social enterprise itself acts as a franchisor. What they do is they offer training, supplies of public health and goods, and mentorship. Some of the clinics and pharmacies then deploy community health workers to reach remote areas, offering subsidized treatment vouchers. And for this model to be really successful, they need a diverse product portfolio. One example is the social marketing company in Bangladesh. What they do is they have a huge product, at least 100 plus public health goods and services. And the product mix is developed in such a way that those with higher margins subsidize the what we call as push products, where the demand is low or they have low margins. And what you see here is a social marketing company has a nationwide network of franchisee pharmacies with clinics and community health agents in the first mile. And in the last 3 decades, they've prevented nearly 200 million disability-adjusted life years. The second type of a business model that we often see is called the micro-franchising model. So similar to the social franchising, if you replace the clinics with individual entrepreneurs who are predominantly community health promoters, and hence the word micro. What they do is they go door to door selling as well as counseling on health and household goods. And sometimes they offer beyond basic health counseling. The well-known models or the well-known social enterprises in this category are BRAC in Bangladesh and Living Goods in Africa, who have scaled up in the last 1 to 2 decades. If you take a close look at the bag that the micro-franchisee carries here, what you see pictures here is from Living Goods. It's like a bag of magic. You could see a range of products ranging from malaria treatment to bed nets, ORS, over-the-counter drugs, and personal hygiene as well. They also try to add fortified foods, micronutrient powders, and have the ability to take on more nutrition product portfolios into their bag. The third type of model that we see in low and middle income countries is what we call as a pay-per-use model. Here, the 3 characteristics in this pay-per-use model, instead of the farmer or the frontline health worker owning an asset, there's an entrepreneur in the village who owns the asset and then leases out space to the farmer or the frontline health worker. The example that you see here, and this particular model is now evolving into perishables like fruits, vegetables, and dairy. And it started many years ago with community water filtration plants. So what you see here are 2 examples, one from Kenya and from India. And the farm, it's a solar-empowered or solar-paneled cold storage unit, where the storage units come equipped with sensors to detect any spoilage of fruits and vegetables and dairy. The temperature is monitored, and they also try to facilitate digital payments through an app. So all the payments that happen in Kenya are through M-Pesa, and the entrepreneur manages end-to-end from farm to fork to make sure there's no food wastage. The fourth type of business model that we're now seeing is what we call as a hub and spoke model. And they're quite popular in the livestock sector And what you see here is an example from poultry, especially eggs. So the central hub is like the headquarters and manages the core functions. And then we have the decentralized spokes, and here it is the farms, the poultry farms themselves. And the central hub has a standardized process, ensures there's consistent availability of inputs and finance, which leads to economies of scale, but also better bargaining power with the input suppliers. And there's real-time coordination, so the farmers get the support every day through a technology platform. And the supply management is so efficient with the timely availability of key inputs that they can easily manage even inflation and supply chain shocks, protecting communities from going into deep food insecurity. The fifth type of model that we've often seen in low and middle income contexts is what we call as a network orchestrator model. Here, the social enterprise has no asset ownership. What they do is they orchestrate supply and demand in a community, or they match supply to demand. What the example we see here is Heifer International in Nepal. What they've done is they help set up women cooperatives. They give cooperatives a seed investment, followed by mentorship, and then connecting them to markets. Because they're able to aggregate demand from all of these cooperatives, it helps them gain bargaining power with all the input suppliers, leading to better income for their produce in the market. So in conclusion, the right business models can bridge market inequities. And for affordable and accessible nutrition through innovative business models, as Mandana has described earlier, we really need three critical stakeholders to come together. Investors for patient capital so that innovation can be fueled, and also the early risk can be absorbed during the experimental phase. And as Mandana said, government can leverage shared assets for a larger reach of the underserved population. It's not just at the very bottom of the pyramid, the humanitarian segment, but also the bulk of the pyramid who can afford to pay some fee for a good quality product or service. And finally, practitioners who are the architects of the sustainable business models. And I think I can see some of those architects here from the hub and spoke model, Louis Leite here, and also from the social franchising model, Toslim Bhai and Social Marketing Company, also in the audience. So we're all ingredients in this recipe for change, so ensuring that no one's left hungry. Thank you.
Thanks very much, Kalpana. Our presenters have done really well on time, so I'm really excited to have quite a bit of time for discussion across a conversation with all of you on pulling on specific strands that came through in each of the presentations. But I want to start with you, Anna. Anna Hakobyan is the Chief Impact Officer at CIFF, the Children Investment Fund Foundation, where she oversees evidence generation and application. So Anna, I'd love to hear from you what some of CIFF's priorities are in the innovation space. What are the issues you're working on?
Yeah, sure. Thanks very much for the question. And as some of my colleagues on the panel already mentioned, we really see innovation as spanning across product, delivery, and financing. So when it comes to products, whether we're talking about RUTF or other essential nutrition commodities, we're quite interested in supporting innovations around enhanced product formulations. We're also very interested in innovations around packaging to, improve the visual appeal for the users, as well as help with things such as verification of adherence. Importantly, we're very interested on innovations that are to do with behavior change messaging and how do we then improve the uptake of the products, because we know the results and the impacts that we're all seeking will only come if the products are used. So the understanding the utility of the product is so important, and working with users to test that and provide the best educational materials is very important to us. So our priorities also center a lot around prevention products in addition to treatment products. CIFF started a lot of its journeys in nutrition in the space of RUTF, which is an essential treatment commodity for severe acute malnutrition, but we're very interested in looking at prevention, so things like SQLNS and MMS. And we're working with a number of partners, including some in this room, Site and Life, DMS, and others around innovations in those prevention products. When it comes to delivery, we're very interested in looking at how do we bundle delivery of services when it comes to these products. One area that we started working on is integrating nutrition and immunization service delivery, for example, and we launched a partnership with Gavi around this, and we think there's a lot of efficiencies to come, not only from the funder and financing perspectives, but importantly, when you're talking about the limited time of the households, mothers that we're seeking by bundling and combining and making the services much more efficient for them, we think this is another crucial area. And finally, when it comes to innovations around financings, which we will touch upon a bit later as well, I think things like the Commodities Match instrument that's been set up under the Child Nutrition Fund, where essentially donors are matching every dollar that domestic governments put towards essential nutrition commodities such as RUTF, SQLNS, MMS is important. We're really helping unlock domestic financing, which we think is going to be the route to sustainability by incentivizing and creating precedents for budget lines for certain commodities, which have sometimes in the past have been neglected. So it's a bit of a summary of our approach.
Thank you. I wanted to turn to the issue of how you create demand, or where the demand for innovation comes from. We've talked throughout the conference, we've been really covering, there are lots of innovative solutions that are out there. The conference was full of panels discussing really exciting approaches. But how do you determine what is the problem that is that we need to solve? What are the steps of doing that, and what are the most effective approaches in your experience? Maybe, Mandana, you could start, and then we can go to some others.
Yeah, thanks so much. I think from our perspective, as I noted, we focus on proven nutrition interventions, making sure that there is evidence, of course, for interventions that we would recommend to the governments to take to scale, or we would support the government to take to scale. And then we really try to basically work through the government to understand what are the obstacles to the delivery of services to the systems that exist and how we can improve those systems. So just maybe an example can portray this better is a project we started actually in the middle of the COVID pandemic in Pakistan to help the government think through the transition from island folate supplementation during pregnancy to the multiple macronutrient supplementation. Because from our perspective, again, the product, the evidence is strong, it is better, it has additional impact, but it's not an easy feat for a government to switch from one product to the other. And the recommendation from the WHO was, this has to be done in the context of rigorous implementation research. So we started by the government, and we even built the research in a way that in the process of identifying the research questions and implementing that, you would have the buy-in and engagement from the different government influencers at the same time. So we went through a very consultative process, similar to, you may have heard about the Child Health Nutrition research initiatives process, to even identify research problems or research questions. And this has been done in the past also to develop a research agenda for child survival. We used it to understand better what's on top of mind for actors at the national level and at the subnational and district level. A lot of the questions related to the switch were actually about health system. So many of them are not even specific to implementation of MMS, but would have directly impacted the MMS implementation if they had not been addressed. So that's one way for us to identify, what are the problems that could potentially affect the rollout of an innovation in a context, engaging those who are working in those contexts to actually help us identify the question. And then develop implementation research or operations research around addressing those questions. I mentioned research in different and I know it's a word that sometimes is not well received because you feel like, you have an innovation, you have a better product, you want to go to scale, you don't need necessarily more research. But here, implementation research is really basically delivery, but delivery in a calculated way so that you collect the knowledge and information needed to keep improving and to keep delivering better. So that's really the role of implementation research, and I think public sector needs to learn to be more comfortable with that, with having that word included in our investments, and really start from doing implementation research around problems that are identified through the implementers in the field. So that has been a successful example for us, and it has helped also with the delivery itself, because by the time we got to the rollout and the scale, there was a lot of understanding of the innovation and a lot more acceptance of it as a new product in the system.
Great. Anneleen or Adeline, would you like to comment?
From my side, it's a bit more a technical perspective, and I hinted a bit at it. When you're trying to design an innovation, you're trying to solve a problem, and one of the most powerful techniques is to make the problem abstract and think in terms of the functions of what you're trying to solve. Because I think one of the most common mistakes is that you get stuck in the details of the problem and you miss the bigger picture that's actually preventing you to solve the problem. So making an abstraction, thinking in terms of functions, and that then allows you to actually look for solutions in other areas or in other industries even sometimes, where that problem has already been solved, and to then translate that back. So as I said, in nutrition, the problems fundamentally that occur are actually really homogeneous. It's about stability in the product, it's about bioavailability in the body, and it's about making sure that people are compliant, etc. So no matter which intervention you look at, these are things that always come back. And if you make that abstraction, then you can think, okay, how have we solved that problem in another case? And is there a way that we can actually translate that solution back into this problem? So that's how we technically approach the things, abstraction, and then trying to find patterns, parallels, similar solutions that have already been developed and translating them back.
Thanks. Adeline, would you like to?
Yes, I think I'm quite agree that the question is which kind of problem you want to solve and why you want to be innovative. You are not innovative for nothing, but which type of problem. And after speaking about this problem, you will have some opportunity somewhere to go and to find the solution. If we want to be innovative, we have to make sure that at the beginning, we don't have the idea of where we want to go, but really to be open on the problem. If we don't solve the problem, usually it's because we don't have the good question, so being sure to ask the good question, but also not asking too much question or refusing answering all the question. You want to tackle one problem, you don't want to set up 5 new research, for example. So you really need to focus, to refuse, and to believe in your feeling. Yes, if you feel somewhere, you need to believe and to go, and not solving all the problem, but at least taking one.
Great. So in terms of, in all your presentations, there were clear steps that you were talking about innovations that were at different steps in the scale-up. So what are the steps? How do you determine, what are the steps to get nutrition innovations to scale? And then what are the bottlenecks at each transition phase, if you will? Maybe we start with you, Kalpana.
I think one of the key, the first steps to unlock scale for nutrition innovations is the regulatory requirements. And that we must start very, very trying to early, and right at the proof of concept stage is when you need to understand what are the regulatory requirements, not only globally, but individually at the country level. Yeah? And without that, it's difficult to even design or plan for scale. Yeah? And the second thing is the proof of concept stage is not just about a product or a service mix that is being tested or experimented. You have to figure out the entire model around it, whether it's a market-based approach or through a public sector program. And spending a lot of time and effort on the proof of concept stage is absolutely paramount for any innovation to scale. And then the third thing is around the type of capital that you want to use for scale. Grants are there, but grant funding is also limited, which is where what Anna and Mayank were talking about, the importance of innovative financing. Is it innovative financing in terms of subsidy, co-funding from government and others, but also other types of capital, such as loans, whether it's for smallholder farmers, cooperatives, from the banks, but also more from the partners locally. And then finally, at the scale stage, just when you're embarking on scale, it's very important to understand who the early adopters are. Because very often we might design a product for a specific vulnerable group, but they may not be the early adopters. So the early adopters really can help catalyze scale in the long term. And in terms of bottlenecks, the two instances that come to my mind. And the first is this project that we're doing in social franchising model with social marketing company and CIFF in Bangladesh. So MMS is a new product. Women have taken IFA for a long time. Yeah? And in our design phase, with a lot of consumer research and market research studies, we realized behavior change is very complex. And whatever we can do to limit any lifestyle or changes in the consumer behavior can really help take the innovation, MMS innovation, to scale. Yeah? So we decided that it should make sure it's not a chore. So, and the packaging and all the promotion guidelines talks about take MMS daily. So it's not about every other day, not in your second or third trimester, but whenever you see your doctor, once the MMS is prescribed, take it daily. Yeah? And also it's about the other big bottleneck that we see, especially for food-based innovations, nutrition innovation, the last mile is, how do you sell the concept to the consumer? They buy food, they don't buy nutrition. This is especially a wicked problem for fortified foods. How do you make them pay extra for fortification? And it's very important for nutritious innovation to stand out from all the other poor substitutes in the market, especially with the fortified foods. Yeah.
Thank you. Anneleen, would you like to?
I think from a manufacturer perspective, the two biggest bottlenecks are first, especially for the most disruptive innovations, there's a lot of investment that's needed up front before you see any return. And having the ability to spread out the risk, both financial, but also just the pure risk of investing in disruptive innovations across different parties is something that can really help a lot. Because if one party has to carry everything on themselves, it's almost impossible. The second biggest bottleneck for us is typically it's the chicken and egg problem, because we know that our interventions have to be affordable, they have to be widely accessible, but in order to get there you need the scale, and that is the typical chicken and egg problem. So I was very interested in the financing talk, because you need to somehow be able to step up the volume to also be able to get to the necessary affordability, and especially in the very early stages that is really, really challenging often. So.
Such a good segue to the next question, which is on innovative financing, building on your presentation, Mayank. What is the role of innovative financing in bringing innovations to scale, and what is needed to attract a class of investors at each of the different steps? Maybe Anna, start with you, and then go to Mayank.
Yes, sure, thank you. So what is needed to attract a class of investors? In our experience, what's been really useful is to have really concrete costed plans at country level. So we're working on a lot of global issues, and we see a lot of global calls to actions, which are really important from advocacy standpoint. But they're not often accompanied by really detailed, implementable, costed plans. And we found in examples where these existed has really helped galvanize investors, because you have investable propositions that you can go in and fund. It can also really help with donor harmonization and coordination, because you can actually see who is going to fund where and avoid duplication and really make sure you're working in synergy. What sometimes also helps is having catalyst investors, and different investors will have different risks, and different preferences as to when they will come into the investment cycles. So some of those early catalyst ones could be, for example, one such class of investors could be private philanthropies, who are a bit more nimble with their availability to go, but they will not have the total financing needed. So they could be a catalyst to help broker some leverage deals, which then can follow through from bilaterals, multilaterals, or domestic governments. And we have indeed, brokered a few really useful deals, such as the one that we worked on with USAID and others last ANGA, to mobilize resources for prevention and treatment of child wasting with a range of partners. So I would say those are really important things. When it comes to innovative financing, maybe just to highlight that we should also not forget the suppliers, the producers, who also have varied financing needs, as we touched upon. Some of them have very difficulties accessing capital. So a few innovations that we worked around there is how do we help with pre-financing of the supplier base for nutrition commodities. That also helps reduce the price, which helps us, address some of these growing financing needs that, my colleague talked about. Working capital loans and others are also going to be essential for the producers to meet the growing demand for products such as RUTF, MMS, SQLNS, and others.
Yeah, I think I'll probably echo what Anna just said. And I think, again, just like thinking about the value chain from when you look at discovery, of course, there's a lot of capital that companies would invest themselves around R&D, but also attract potentially this grant capital also being invested in terms of actually focused on more upstream. But I think the role of innovative financing becomes more interesting when it starts to around aspects of scale up. So I think loans is in particular very interesting. And if you look at it, even the element of the type of loan, right, what is the need, is extremely important to highlight. There is working capital needs, but then there are also issues around loan guarantees, which is around, do you need a guarantee on a loan when you're sourcing capital from cooperative banks, especially in Africa? That can be extremely challenging for newer suppliers who are trying to enter the market. And then comes sort of the different rules around advanced market commitments that also help in bringing confidence in suppliers and getting internal alignment and commitment around allocation, volume guarantees, of course, as mentioned. And then I think there is, of course, the role around of financing around procurement, because ultimately somebody needs to buy and somebody needs to finance it. So, of course, instruments such as the match funding, also in terms of other sources of domestic finance, creating internal fiscal space as well is something that we should not overlook, around like how can governments actually think about financing nutrition more broadly. Is the answer around inclusion of aspects around universal health coverage? I don't know, like there could be several ways to actually think about how you create internal fiscal space as well over time. And then I think finally there are other elements that we shouldn't forget, which is not innovative, it's traditional, but around programmatic financing, which is, yes, a product will be available, but how do you actually ensure that there is uptake, guidelines are actually being changed, etc. So the role of grant financing becomes extremely important. So I think at each step, depending on what the barrier is, there is an answer to the type of financial instruments needed. And in several instances, it may not be an instrument alone, but actually a blended financial structure that actually helps in, like, as Anna was mentioning, around catalyzing financing, etc. That will become important.
Thanks. Adeline.
Just a reaction, because as a private sector, we don't have access to innovative finance, I think. You can have access for non-for-profit, for government, if you want to scale up an innovation. But if we want really to, I think, to scale up local production, to give a local answer for nutrition, we are in a country at risk where if we look at investors, even if they want impact, they don't want to change their return on investment. So in fact, the cost of money is very expensive when you are, for example, in Ethiopia or in Nigeria. If you are in Sudan, you have big risk to have your factory burnt, but in fact, you have to repay the same. And so I don't know if someone knows, but innovative finance for private sector in at-risk country. Could we have an investment fund that agree to lose money? Because we can demonstrate impact. So they agree to lose money on private sector. So I would be very open to discuss if someone wants to be innovative on that.
I've got a couple more questions, but please think about your questions. We'll get to that in a minute. And also online, if you've got questions, one has already come in. So please do add your questions online. So my next question is really about the last mile, reaching the people most in need. With the 2030 deadline upon us, what can we learn about reaching the last mile? What innovations have been transformational at the community level? And how do we reach the communities? Maybe Anna, do you want to start there?
Yes, thank you. I mean, one of our biggest learnings there has been that context is critical, because reaching the last mile in one country looks very different to reaching the last mile in another, and even just within the same country at subnational level being so many variances. So I think, you know, it's only going to be possible through the result of sustained work with local stakeholders to come up with the solutions that are going to work for the last mile in a given context. Community health platforms will remain essential in terms of reaching the last mile. So we need well-trained, well-remunerated, well-supervised, and where contextually appropriate, digitally enabled community health workers to help us in the journey towards reaching the last mile. Again, I think innovations, not so much innovation, but good practices, and that we're seeing, in the area of community health, health center quite a lot around integration agenda again. And that is, again, going to be critical when you're able to get a hard-to-reach user, a mother or child, how you bundle your services to make the most of that. So we see a lot of potential there, and we've been excited to work with also partners like Living Goods in community health that have been doing this for a number of years, and we continue learning and improving in that area.
Great. Adeline, you want to talk about the last mile?
I don't know if we've got a lot of good experience for the last mile topics. I think it's difficult. We should be able to be more hybrid system on these last miles, but also to make sure that when people are moving in some place, they can find everything. We know that for nutrition in health, the issue is often that the health system is parallel at the nutrition system. So if we are not able to reach the people at the community level, at least make sure that in the nutrition or in a health center, we've got everything at the same place.
Yeah. I also wanted to comment, I think we haven't done a great job of really incorporating this last mile perspective, especially, as the child survival movement gained momentum, this focus on a scale and scope and really low-cost, high-impact interventions, which my organization is focused on, and I think we have delivered on that well. Just by the token that then you would go first to places where they're easier to reach. You want that quick impact, you want to really scale up high. And we've done it, and I think that has been perhaps the right way, but now we've gotten to a point where it's more expensive. That next life to save is more expensive. So in simplistic terms, I think now we have to go back to the same donors and say, well, we're kind of give you the same increase in numbers every year at a higher cost. And that is a bit of a justification that we have to make. And we are now in the process of having new approaches so that we keep that scale and impact, but also there is a hard-to-reach policy, there's a hard-to-reach approach, there's a hard-to-reach package of interventions. And if we don't do that, I don't think it will not necessarily happen, even through the public sector. Because as I said, we are focused on low cost, we are focused on the low-hanging fruit. So I think one thing would be, again, having a specific hard-to-reach approach and strategy. and bring innovation into that. Some examples of it, for example, would be for us, we support weekly iron folate supplementation for adolescents through schools. But then the hard-to-reach ones are the girls who are out of schools, and probably they're the ones who need it most. So we have actually now started testing in West Africa mobile clinics that would go to communities and would identify girls who are out of schools and would be able to then deliver services that. And that's an innovative way to have hard-to-reach approaches. Probably more expensive at first, but I think in the long run it will have results that would really benefit everybody.
Thank you. Are there any questions in the room? If you do have a question, line up behind the mic. In the meantime, we have a question online. To Mayank, you mostly used phrasing, it's from Alexandra Vasileva. You mostly used phrasing instruments such as, when talking about volume guarantee, can you name another similar financial instrument and innovation in the field?
Yeah, I think if I look at the purpose of a volume guarantee is essentially to help absorb risk in terms of the unpredictability of demand and whether there will be adequate demand when products are being launched. In my mind, I think that the one that probably comes closest to it, again, which is a commitment between, let's say, like an innovative financing provider, social finance company, philanthropy, right, would maybe be an advanced market commitments as well that are actually offered frequently in other institutions. The difference, though, between an advanced market commitment and a volume guarantee is that a volume guarantee is usually multi-country, multi-year, while an advanced market commitment could be shorter duration, fewer countries, and also the intention is directly between an agreement between a buyer and a supplier. While a volume guarantee, it's not the buyer necessarily who's guaranteeing, it could be any type of a guaranteeing institution, MedAccess, Gates Foundation, etc., who can actually do investments like that. So I think a like-to-like comparison, I would probably think that's an exact, a second example. But yeah, curious if Anna, if you have any second.
And advanced market commitments have been used a lot in the vaccine space, right?
Yeah, I think so. I think in vaccines, also you see it in certain instances of TB, HIV. I think a lot of it is where there is financing which is already crowded in by organizations like Global Fund and PEPFAR, where there is a lot more predictability around financing. I think predictability of demand also comes from predictability of financing. So it kind of flows together. Yeah, I think, so the success of it has been most seen in those instances.
I said questions in the room, but there's a lot of experience in the room too. So if you have any examples or things you want to talk about, please do. Yeah.
Hi, my name is Louisa van den Broek with dsm-firmenich, and so very interesting. You all shared so many different things to take into account into an innovation process, and you even started with the whole process. It mentioned time, but it didn't mention the amount of time it takes. And if I hear all the things you put forward, context is important. So what works in one country doesn't work in the other. But then it really makes me concerned about the time of an innovation cycle, and it only seems to get longer because of all the things we need to take into account. So therefore, I was very curious to hear from all of you, what do you think would be ways to actually accelerate those cycles?
Anyone want to take that? Yeah.
I think that times really depends of the time of innovation and if you can do it by yourself or if you need partnership. We spoke a lot about SQLNS. We start working on SQLNS in 2003, so we can say it takes time. It was 20 years ago. But for example, we put some toys in our cartons. So in each nutrition center now we've got toys. It was very easy. We proposed that, and in 6 months we can do it. So it depends on the number of partnership and how much evidence you need to have to scale up, I think.
I can add a few examples to what Adeline had mentioned. The two types of, the couple of examples that come to mind. The first one is especially innovations, nutrition innovations in the last mile, the role of government partnerships. An exemplar for me is Africa Improved Foods in that started in Rwanda and expanding to other parts of Africa. The role of government was that more than just a shareholder, they have been a partner right from the design phase. And when you bring in collaborators like the government, you start seeing an impact and scale immediately because of the shared networks, the channels, and as well as the assets. The second way to accelerate scale of innovations is through policies. And policies can either be upstream or downstream. Upstream is what Adeline has covered. You can provide incentives to producers so that they can immediately figure out how to take the innovation and produce it in a volume and make it affordable, yeah? Through taxes, tax incentives, subsidies, but also sometimes if you partner with the producer early on and not do an innovation at a lab stage, and invest in the R&D, then the time to scale could also, the time to innovation to be produced can also be shortened. And then finally, policies can also facilitate demand. The tricky part of nutrition is largely demand. If you have, like, if you bring in partners, government, philanthropies early on, and through demand creation campaigns, consumer awareness campaigns, and that we are already seeing, especially in the large-scale food fortification space, where a number of governments have taken ownership and they're doing brand-agnostic consumer campaigns, then because when demand leads, supply succeeds, and that can immediately take innovation to scale. Yeah.
Add something. I think it goes too slow. That's the reality. We've seen how fast a vaccine can be developed in the last 3 years if there's a high sense of urgency. So I think on the one hand, it just goes too slow and there's a higher sense of urgency needed. On the second, where I see the biggest improvement opportunity is the more efficient we will get at gathering data and using that to do predictions, the faster we will be able to be. So I gave that example, for example, on the fortified kernels. The more data sets you have that tell you already how a certain mixture will behave throughout the extrusion process, the shorter you can make the development cycle. The more stability data that you have from different formulas around the world, the more you can see the patterns and the trends, and very early on in that stability, which is often one of the massive bottlenecks in bringing products to market, make predictions. So that will help, and that sounds maybe super easy, but data gathering is actually very, very difficult. It's a huge effort to get good data sets collected. And it's almost the easiest part is almost the analysis. It's actually the collection of the data that's incredibly difficult. And especially, we've just heard about all this complexity. Those data sets are sitting everywhere. So to collect them in a proper way across this whole landscape of people who are holding data is actually a pretty big challenge, but probably also the biggest opportunity to make things go faster.
Anna, you wanted to go?
Yeah, and just to quickly add as well, a great question. I think through our experience and learning, another thing that can help is actually getting the buy-in and understanding and inputs of key stakeholders at the design stage. I think sometimes as a sector, we have, in the past expected to do innovations and then somebody just scales them. Doesn't quite work that way, So if you involve the policymakers, the key stakeholders at design, it also can shortcut the scale up of the innovation if it proves, to be successful. Having parallel tracks of innovations and not necessarily just sequencing is also quite helpful, and working in multiple contexts, ideally as well. We have, again, in the past, have sometimes as a development sector, proven something in one country and then again expected global take-up in different countries. So I think early input, parallel tracks, hopefully can also short track some of those.
Great.
Just one last thing, because I didn't hear it. I think it's also important to think about the right kinds of public-private partnerships that could activate innovation or be part of the innovation. Because part of the slowness is also just the different timelines of the public sector and the private sector and the adoption time that it has. I think it's important, for example, for the private sector to know and maybe kind of understand and work alongside the processes that we have at the national level for decision-making. You know, it has to be on the essential medicines list. It has to be, you know, certain kind of evidence has to be available before it's even considered for adoption. And sometimes we wait till the product is developed and is ready to go to the field to activate those. I think if this was done through a public-private partnership process, then we would have been aware and, you know, alongside the development R&D process in the lab, the public space, a space for innovation would also have been activated at the same time. So if we can do a better job of that in nutrition, I think we can actually take away a few months or even years from the process, hopefully in future. Thanks.
That might link to a question online. Can somebody comment on the regulatory requirement for an innovative product? Example, medical food, food for special medical purposes. The question is from Martin Ullman.
I mean, it's part of my responsibilities in the company. I'm not sure exactly what the question is. So food for special medical purposes is a specific European regulation. There are equivalences around the world in the US, etc. So I'm not 100% clear what the question is, but fundamentally that there are very specific requirements attached to that you have to meet. And yeah, if you want to market the product in that area, you basically have to meet those requirements. I would say they are actually crystal clear. I think one of the more difficult things is when you have interventions that have different regulatory classifications around the world, like we are facing, for example, with MMS potentially, that actually makes it incredibly complex to execute. Because those requirements, if they are different at the back end, you cannot each time change and adapt your front end because you become incredibly inefficient in that way and you lose a lot of the scale benefit. So I think if the regulation is clear, it's actually a lever to speed to market. It drives quality, it drives ease of market entry. I think the biggest challenge is if they are not clear or if they are different across different parts of the region, that is when it becomes very complex. But I'm not sure that really answered the question on FSMP and MN.
How do you the next question is, how do you balance deciding when to develop new innovations and when to implement existing solutions and not let the perfect be the enemy of the good? And that comes from Evie Stretch. Lots of smiling faces on the stage. Anyone want to tackle that?
I mean, again, I can talk about the process that we have. I think for us, evidence is the starting point. So evidence for impact. And, you know, again, knowing it's for us, priority is life saved for populations that are most in need. And then secondarily, we look at the cost and cost per life saved. And, you know, we would use that in a tool that allows us to make a decision across the priorities of mix of interventions. So I don't think it's necessarily about new versus old. It's more about the strength of evidence and whether we have proof on the strength of evidence. So sometimes, again, new interventions come in and there is not a lot of evidence on effectiveness in the field. If we can produce those early enough, they will get into the mix and they will be considered alongside the other interventions as well. So that would be my approach to it, thinking about adopting new interventions.
I don't know if we ask ourselves this question, because if we know that it's not the good one, it means that we know what would be the good, so we will do the good. Usually we are not sure that we know exactly what is needed, so we'll put something on the market, or we will, for example, we develop a product for adults with malnutrition called Nutriop. We are not sure it was the good at the beginning, but we put the product, and after it makes the discussion come in, and so we can improve the product. But if we know that is not the good, we don't put the... Sometimes we don't know, and that is the main issue.
Yeah, I think affordability is what also drives that decision, because you can get fantastic interventions, but no one will be able to really afford them. So I think it's often in the design process that you bring in affordability early on, so that what you end up producing, will effectively be marketed. And I think that's the biggest trap, that if you would ask just pure scientists to design, they would give you wonderful things, but they will never ever be affordable for the population. So I think that's for us usually the trade-off between the strength of the formula and the evidence and the affordability.
Great. Martin Ullman did, sorry, go ahead.
Yeah, sorry, I think from our perspective, when we are evaluating products that we should potentially back or provide some financial support on, I think one is we definitely look at what the incremental public health impact is going to be from the product. And often we would see that even some minor changes can actually change that a lot. And also keeping in mind how will it be adopted, right? Like how would you expect healthcare workers to adopt a product? Sometimes innovations can also make it easier from an administration point of view, in addition to the actual efficacy of the product. And I think secondly, we also want to just think about sometime penetration, equity, and some of those aspects to ensure that the product will actually reach. So just two additional elements to that.
Thanks. Just closing the loop, Martin Ullman did come back and he said it was exactly his experience. Almost every country has more or less severe differences, so thank you. So we have literally come right to the end of our time. Please join me in thanking this amazing panel and Rodger Voorhries for submitting the video.